I cannot do that, I'm tired. Now let me really show you what is happening.
Yeah.
So low back pain can either be acute, subacute, or chronic. People usually will come and expect you to just do some magic for them, but you know.
I mean, they call physiotherapists magicians.
Yes, we can do some magic, but just like the cause of it is multifaceted, the management also is multifaceted.
Hi everybody, welcome to another interesting episode of the Physiotherapy podcast. I'll be your host Alima. Today we are going to be talking about low back pain, and I have here a very interesting man. I have the honor of meeting him for the first time myself, but I have heard so much about him, and I'm sure that you would also learn so much from him by the time we are done with this episode. So stay tuned and enjoy. Alright, so today's episode, like I said before, we are talking about low back pain, and my guest is pretty interesting man. He is currently the CEO of the Physio Specialist Clinic. He's also um, the lead for clinical rehabilitation division and the head of physiotherapy department at the Nyaho Medical Center. He had his BSc in University of Ghana, and then he furthered to the University of Nottingham to specialize in manual therapy. And he has other things going on for him, so I think I would let him throw more light on the other things that he does when it comes to physiotherapy, so that we get to know him more. So he is in the person of Mr. Samuel Kwekuotu. You're welcome.
Thank you, Alima. Good to be here.
Yeah, it's so nice to have you on our stage.
Honored to be here.
Okay, can you give us, do you do something else I have missed in your intro though?
No, I think what you said is just spot on. I mean, I used to be the president of the Ghana Physiotherapy Association.
Yes, I missed that.
Yes, but yeah.
And a lecturer as well, right?
Yes, and lecturer as well.
Okay.
Yes,
That's an interesting portfolio. Were you always like geared towards the education aspect, or you just found yourself there?
Not really. I've always loved to teach, to actually talk less stuff from there. I love to talk to people, you know. So, when I did my masters, my masters was a clinical based masters, you know. So there were a lot of wonderful things that were taught, and I felt when I came back, I felt that this needs to be impacted onto the next generation. So. Coupling that with my love for teaching and talking, I decided to just do the lecturing stuff. So that's how it come. But originally, I love being a mechanic.
Oh, okay.
Yes.
That's interesting.
Yes.
Anyway, so 8th September marks the World Physiotherapy Day, and in 2024 we are celebrating on the theme low back pain. So our speaker here is going to tell us a bit about low back pain, and it's quite a broad topic. So I want you to touch in the little areas that you think are very significant and vital that the general public need to know about when it comes to low back pain.
Yeah, good. So like you already said, low back pain is quite broad, very common. It's the leading cause of disability. Globally. I think in 2020, it was estimated that about 619 million people worldwide had low back pain.
Wow. And
it's estimated that even by 2050, that number will increase to somewhere around 800 plus million. So obviously, it's something that we cannot ignore. But when we talk about low back pain, basically we're talking about pain felt anywhere between your large rib and the lower gluteal fold, or just your gluteal fold, the lower part of your butt.
Okay.
So that region of your body, pains felt there can be categorized as low back pain. And a number of plethora of factors can lead to low back pain as to what will cause it. Let me start by saying that um, there's so many factors that can lead to low back pain. Some we don't even know, but the commonest is postures, wrong postures. Let's talk a bit about the body. So the body is structured in a particular way. The body is symmetrical. Most things are two, hands, ears, and stuff like that. The muscles in our bodies are also same. So you look at your back. There's the vertebral column in the middle, muscles on both sides. And they support various actions and stuff like that. The body likes to be maintained as such. Anytime you do things to favor one side of the body, there's a problem. So by the time you go deep down, you realize that if a patient comes to me and says, I have low back pain, and we go down and do our assessment and everything, most often than not, it is just because a certain muscle, a certain tendon, a certain ligament, something has been overworked, has been overstretched, has been not, should I say, utilized optimally, and all of these things will cause low back pain. Another thing too is that the body works like a factory. A factory, let's say a production factory, bottling company like any of those, Coke or beer or whatever, where we have different machines doing different stuff. So one machine, let's say, will align the bottles. Another machine, we put another machine that will refill the content. Another machine will put the maybe the label, all of that. Anytime one machine breaks down, it affects the integrity of the production. Yes. So in the body we have muscles, we have bones, we have ligaments, we have tendons, we have disc, all of that. Anytime one structure malfunctions or is not working optimally, the others try to help, and that affects the whole process. So a patient may come to you typically with a certain, pain. Maybe originally it was something that was overstretched, but because of that, the muscles can be affected because they're trying to help people do that job. Yeah. So we cannot talk about low back pain without talking about postures. Like I said, every activity that we do is sponsored by muscles. Everything. If I want to hit somebody, the group of muscles that are working to make sure that this happens. Okay. Let me talk a bit about muscles, then I'll come to what I started talking about. So, there are two main groups of muscles. There are the global muscles that we see on the outside, the big ones, the biceps and stuff like that. And then there are the core stability muscles that are inside that we don't see. Now, these core stability muscles are closely attached to the bones, and that's when movement is initiated. Muscles mainly do two things. They bring about movement. If I want to do this, it's a certain muscle that is contracting to move the bone. The bones don't move. The bones are just sticks in there. It is a certain muscle that is moving. Of course, you can even stretch it and say it's the brain that decides it. The brain sends impulses through the nerves, and then the nerves, of course, will send it to the effector, that muscle, and all of that will happen. So this is a major thing that muscles do. But nothing that muscles do also is to bring stability. Because the bones are just sticks in the connecting at the various joints, we would need to have something holding them together when movement is taking place. And so most often, what happens is that when those muscles that are supposed to do that job are not working optimally, you are able to move all right, but there's a lot of, we call them aberrant movement, unnecessary movement going in us, and we don't even feel it, we don't even see it. And that would eventually culminate into a certain pain that you feel at your back. All right. Let me come back to low back pain. So low back pain basically can be either specific or non-specific. So we're talking about specific low back pain. We are talking about low back pain that is caused by a specific disease or a specific structural change. Maybe a certain bone is shifted, or a certain bone is broken, or a certain ligament is torn. So it's very specific. We know that because of that, that's why you're having that. A certain nerve is being impinged upon or something like that. So that's specific. Then we have the non-specific one where we're not sure what is causing the pain. Interestingly, about 90% of low back pain cases are non-specific.
Oh.
Yes. And so for us as clinicians, we are always encouraged not to be too fixated on the physical structures. So for example, we are advised not to use a certain model called the biomedical model, where you are looking at the patient and just concluding that your pain is as a result of a certain bone that is broken or a certain ligament that is strained or something like that. But to look at the holistic picture using a model called the biopsychosocial model, where you are not just thinking about the physical structures, but you're thinking about the whole psychology of the patient, and there is science behind that. I mean, somebody may be feeling a certain pain, and it's not because a certain muscle is torn or something, and it can be explained. I'm sure we'll have some time to talk more about that, So low back pain, of course, is multifaceted. I tell people that unlike your malaria, your typical malaria that is caused by a plasmodium parasite. So mosquito bites you, inject plasmodium parasite into your system, and you start getting all kinds of feelings, fever, so all kinds of symptoms. Fever, maybe headache, loss of appetite. Doctor prescribes malaria drugs. Malaria drugs go into your body, kills the plasmodium parasite like a blue man, and then everything is over. Yeah. But low back pain is multifaceted. There are a lot of stuff that bring it. Exactly. It's not just something specific. So in dealing with it, we need to also think, like that. Yeah. So let me go back to what I said about postures. A lot, and I've done this thing for some time. I've had so many patients. Majority of the kind of patients we see in the clinic are having the symptoms they are having just because they didn't do something right in terms of posture. They didn't sit right, they didn't stand right, or they didn't even sleep right. So once we're able to fix that, it takes care of it. Like I said, the other cause of low back pain that we may not have so much control over. You fell down, you broke a certain bone, or there's some UTI, that you don't even know how you got it. You just on some public toilet and something happened. You don't have so much control over it. But then you can just decide to take care of your postures, and that's the easiest to also take care of, and it will take care of your low back pain.
Okay. So, talking about postures, I think we'll have to have another episode with you where you take us deeper into postures. You talked about the sitting, the sleeping, and all that. So, maybe we'll have another episode where you teach us the proper postures, what we are supposed to do and what we are not supposed to do. But coming back to something you said, you mentioned that low back pain, it happens between your last rib to your gluteal fold. There are certain times that people come and they complain about pain that transmits from their low back down to the back of their thighs, sometimes even to their calves and sometimes their feet. That's not qualified as low back pain.
So that would. So that is what they call sciatica. So just a bit of anatomy. So the back is made up of bones, 33 bones, lined up from the neck all the way to the butt. Now these 33 bones are separated, each two are separated by, or any two are separated by a disc. The disc is what we call the intervertebral disc. Now, when you take one disc, it's made up of a thick gel in an outer fibrous layer. It does two main things. Acts as a shock absorber. So when you jump, for example, your bones will hit on top of each other. So it cushions, your back. And also enables us to flex and bend and do all that kind of stuff we do. Yes. Now, when you pick, I said at 33, when you take one bone, it has a hole in the middle, somewhere in the middle. So all the 33 bones have holes that form a canal, a lumen, and that is where the spinal cord passes. So the spinal cord is a continuation of the brain, very delicate. So God in His wisdom had to really protect His bone. That's why we have all these bones. Yeah. Now coming out of the spinal cord at various levels, passing. So the bones are are some way like that. So it has a middle part, a body part, and more like appendage on the side. Okay. Now the appendage or the side, we call it a transverse process of a bone up and the bone beneath it on the side form another hole, a canal, and that is where the nerves pass. So we have various nerves coming out of the various holes caused by the two adjoining bones, and then they go to various parts of the body. Okay, so bone up is be forming a certain N, and bone down is forming a certain U, and then they are causing a hole that the nerves are passing through. Now, one of the things that is sponsoring this hole, making sure that this hole is big enough for the nerve to pass through, is the intervertebral disc, which is in the middle. But that is separating the two bones. Yes? It means that if anything goes wrong with the intervertebral disc and it reduces in size, it's going to affect the volume or the size of this hole. Now, what can go wrong? Somebody goes to the office for morning, 8 o'clock, sits behind his table, works, sits down till lunchtime, 12. The force of gravity is acting on us. So there's a lot of this happening to your discs, especially the lower, because it bears most of the body's weight. So a lot of this is happening. Anytime you get up after like an hour or two, it kind of starts after you start off for a refreshing. But you have so much to do that you don't have time to get up. So there's a lot of this happening. A time comes that now even when you get up, the bones don't come back because we say it's degenerated. The volume or the size of it now has reduced. Now that is what medically they call spondylosis. Now spondylosis means that when you look at on your X-ray, you realize that the volume or the size in between the two bones, any of the two bones at the back is reduced. Now, so that is what's happening in the middle of the disc. Now the effect of that is that on the side, where we had that hole, the nerve passing through, if the hole was this big, now we're getting something like this. Now that can easily impinge on the nerve that was passing through. When there's pressure on the nerve, it gives symptoms, we call them paresthesias. So it could be tingling sensation, numbness, all of that. Sometimes hot and cold sensation, stuff like that. Now the biggest nerve, like I said, the body has got a lot of nerves. The nerves are going on. The biggest nerve that controls the legs is called the sciatic nerve. So it starts from the back and it splits into two and it goes down the legs. So when we've had this that we've explained happening, and the root of the nerve, that's where the nerve starts from the spinal cord, is impinged upon, then you get all these feelings along the sciatic nerve, wherever the sciatic nerve passes. So if the sciatic nerve is passing right through your butt all the way down to your leg. So when there's pressure at the lower back there, you're going to get effects down there. So your question is very relevant, because I had said that the pain is between the large rib and the lower part of the buttocks. But then the source of this pain in sciatica is really there. When we are treating sciatica, we don't come and touch your leg, even though the patient actually is telling you that the pain is in my leg. The pain is on the lateral part of the side, outer part of my leg here. Some say that, my foot, I'm getting all kind of, yes. Even though you feel the pain there, it's a referred pain. You call it a radiculopathy. It's because the source of the problem is somewhere at the back there. So it still falls within our range, So yes, your question is right, but then it's still low back pain because we want to deal with the source. Yeah.
So are there situations where someone would have these sensations and not necessarily come from the low back?
Yes. So somebody may have sciatica, pressure on the nerve, but it may not be coming from the waist or the lower back. Okay. So a typical example or a major one actually is a condition we call Piriformis syndrome. So when you look at the buttocks, there is a very tiny muscle that is moving from your hip, somewhere the hip bone, towards the sacrum. The sacrum is one of the bones at the lower back. After the lumbar vertebra, 5 bones fuse together form the sacrum. So this muscle is connecting the hip bone to that side. Unfortunately, or not unfortunately, interestingly, a lot of people have their sciatic nerve passing through this bone. Majority of us have the sciatic nerve passing through that bone. Some people have it passing on top, some down, or something like that. But like a majority have the bone passing, the muscle passing through them. Now, anytime there's a problem with that muscle, is strained, is not working optimal. Muscles naturally are supposed to be able to stretch and relax, doing various activities like, taking my leg out, moving and all that. So if something happens to that muscle, it puts pressure on the sciatic nerve. So that can mimic what we spoke about first. Yes. So usually when you see your physiotherapist, they will carry out assessment to really decide or get to know whether the source of the pain is coming from the lower back or is, I want the lower back, the spinal, the pressure on the nerve, or from the lower back or from the piriformis, muscle. And that's what we call the piriformis syndrome.
Okay, so when it happens like that, do you tackle the piriformis muscle, or you treat it as a general?
Yeah, so that's what. So once you do your test, and there are various tests that physios will carry out. Once you do your test and you realize that it's coming from the piriformis muscle, all you need to do is to deal with the piriformis muscle. And sometimes it's as basic as just putting pressure on the muscle. So muscles are tight, and when they get tight like that, once you put a lot of pressure there, they open up. So a lot of pressure, and there are various techniques that we use to really put pressure and to really stretch it. And then there are other exercises that your physio will teach you to really help stretch the muscle.
Okay. Yeah. So as a physiotherapist, how often do you see low back pain patients, and do they have something in common? Is there a specific, let's say, lifestyle trait you have realized in most of them?
So if I see 10 patients in a day, I can confidently say 7 of them have low back pain in my clinic.
Wow.
And that's mainly because I see a lot of corporate workers, sedentary workers. So 7 out of 10 in my clinic are coming to me because of low back pain. And you're asking, do they have any common trait? Well, most of them are sedentary workers. They are sitting down for long hours. They are sitting with their backs not supported. They are using a certain laptop that is very low. So they are, curving. And this is sound a bit technical, but like I said, we can just break down your symptoms and bring it down to find out what really caused it. Okay. So a typical example, somebody is working, sits in the office, using a laptop, always on, a certain accountant, a certain auditor, and is stood like that and is working. One of the basic things that happen is that we can easily distort the shape of the body. Remember I said the body is in a particular way. God made it in a particular way, and God wants you to maintain as such. Any deviation from it is a problem. Yeah. When you look at the spine, the whole vertebral body, when somebody is standing in front of me and I'm looking at his or her spine, an X-ray of it, it should be straight. It should be a very straight, like a stick, something straight. If somebody is standing and turns and I'm looking at the person's spine from the side, it's not straight. It has curvature, so the neck goes in a bit, the back comes out, the lower back. Yes. The body wants it to maintain as such. There are muscles that are attached to the vertebral column in that curvy, nature. So anything that you do to distort this curvature is a problem. So for most of these patients who come, unknown to them, they are assuming a certain posture, either they made their body assume a big C shape as against their normal curvature because of this, or they are sitting in a way that is slanted because maybe a certain screen is on one side of their body and their chair is so comfortable so they can do that, or a certain phone is on this side, so so you realize that all the things that they are doing is they are doing it to favor one side of the body as against the other. And it's very, like I said, they do it very innocently. They don't even think about it. But the body easily gets acclimatized when you throw at it. Anything that you do continuously for 3 weeks plus becomes a problem. And these are people who have worked, for years. You've done it. Sometimes I talk to people, corporate organizations, and they're like, "Oh, we've been doing this for a long time. Nothing has happened." Okay, nothing has happened yet. But then, the body is very tolerant. The body will just tolerate you, and then one day, bam, everything comes. I have people who are who are on retirement now, and they are having a lot of back issues, and they don't understand, because to them, when I was working, everything was fine. Yes, I was not sitting, but everything was fine. Never going for checkup, everything was fine. Now that I'm coming to enjoy my retirement, my small money that I'm coming to enjoy, every day I'm in the hospital. Yeah. What is it? Is it my family people doing it? You know, yeah. But there's an explanation to that. You know, if there's time.
So most of these happenings in the body as a result of our posture or our lifestyle. When these consequences happen, are they curable? Is there a way you can reverse them, or you can only maintain them? Because I have heard people that low back pain is not curable. You only manage it or you treat it. What do you think?
Well, so I think that it depends. I mean, so low back pain can either be acute, subacute, or chronic. Yeah. So when you've had pains less than 6 weeks, we call it acute low back pain. When it's between 6 weeks and 12 weeks, we say subacute. When it's more than 12 weeks, then we say it's chronic. Okay. So research shows that usually people will fall in the acute phase and it will just go. So some will go like, oh, I've been getting some, it comes and it goes. I don't even do anything. Yeah. So so that one is there. But then if nothing is done, you keep on getting it acute, and it keeps going, and so you assume that is it. It can come back. And then later, once you jump to the chronic phase, then something major needs to be done. So back to your question, yes, it can be treated. People have had back pain, and they've been relieved of it because they've gone through our sessions and stuff like that. But then I keep on saying that it's multifaceted. Just like the cause of it is multifaceted, the management also is multifaceted. You understand? People usually will come and expect you to just do some magic and everything, but
I mean, they call physiotherapists magicians.
Well, yes, it's a bit erroneous, Yes, we can do some magic, but then if you want to be very serious about it, I mean, one of the things that we do, for example, during our initial visits for patients, is to really explain what is going on and understand. And there is a psychological bit, to this, which maybe we'll talk about later on. So it's good that the patient understands that, listen, whatever is going on in your body has been caused by certain actions. So in reversing it, we will need to undo certain things. I get it. People like to be passive about their treatment. So just like you see your GP or your physician who would ask you questions and do some tests and after give you a certain medication, and all you are doing is to go out a certain medication and your thing is gone. Unfortunately, we can't do that when it comes to stuff like low back pain, because, like I said, the cause of it is multifaceted. It has taken a while. Most often than not, by the time you are feeling your pain, your symptom, the body has tolerated things for a very long time until they say that I cannot do that, I'm tired. Now let me really show you what is happening. Yeah. So in managing it, for example, I use a system where there are 3 things involved in my treatment protocol. The first one is what I call the lifestyle modifications. You will need to change something. We need to assess your sitting in the office. We need to assess your sitting at home. We need to assess your sleeping posture. We need to assess how you do stuff, how you stand. People have very fine ways of standing. So we need to change that, because if we don't change that, no matter what we do, you will go back to it again, and then we are wasting everybody's time. So we have the lifestyle modifications. Then we have the therapy session. That's what we are doing, because when you come, most often than not, something has been realigned, something is not working optimally. So we have various stuff that we do. We are doing joint mobilization, we are doing spinal manipulative therapy, we are doing certain electrotherapy, a certain massage. We do physiotherapists use all these, we call them physical modalities. So that's what we are doing for you in the clinic. And the last one are exercises that you need to do to maintain what we have achieved in the clinic. I get it? Because, like I said, whatever has happened to you has happened over a long time. So you cannot come and just do one thing and expect that everything will go away. No, we need to maintain that. So no patient, for example, will not leave my consulting room without an exercise prescription. You have to do the exercise. That's what will bring your relief long term. Unless you want to think short term. So you come and we'll do something, you're gone.
Then you come back again.
Yeah. Our goal as physios is to really make you independent, to make you more functional, to give you an ability to move better. So we are thinking along those lines. We want you to be able to do stuff. If you come and I just do stuff for you passively, it becomes a problem. We want it to be active. You need to lead the whole stuff by getting here. So in terms of treatment, yes, it can be treated. People have had back pains that will just vanish after me seeing them for 3 sessions.
Okay.
Meanwhile, others will come and they have it back and forth. They will come and say, I've come, do your thing again. And, fortunately, I've worked at a few places, and there are people who get very comfortable with physio. I'm going for them to put that hot thing on my back, and go and do some massage, and you go home and go and do all the things they want to do and come back. The thing has come back again, and they put it. It becomes a cycle, and that doesn't really help anybody. I get it. I think that what makes us stand out as physios is our ability to prescribe specific exercise to deal with specific things. Every part of your body can be exercised, every muscle in your body. Most often than not, the problem is that the muscle is not working optimally. Remember I said the muscles hold everything together. So if it's not holding it together, it becomes a problem. So for example, people come in, they want to do a lumbar corset or maybe a knee, or a lumbar corset and stuff like that. And they ask me, so wouldn't you prescribe something for me? And I keep on saying that. So these things are just adjuncts. They are just things that are supposed to help the whole process. Ideally, your body, your muscles are supposed to be able to support you. If you have ever used a lumbar corset before, you realize that anytime you put it on, you feel good, you feel a bit lighter. It's like it's holding something together. That jaw originally is supposed to be done by a certain group of muscles. The reason why your physiotherapist or your doctor will prescribe a lumbar corset for you is that you have come and you are in so much pain. And even though I have a long-term plan for you, I feel that as you're in pain, we need to support things now. So put the thing on to mimic, or not even mimic, to do the job that the muscles are supposed to do. With the plan that as you have kept it on, you will take it off and do my exercises until we bring the muscles to that level. So don't get too comfortable with your lumbar corset. Oh, when I work, I'm okay. Yeah, you're okay. But it will not solve the problem. It will give you a transient effect, brief, immediate effect, which is good. You use it, and it's not like I use it. I ask patients to use it. They're going for some long journey, they're going for your jog, they're going for your walk. It's great. But then we need to think long term. We need to bring your body to that level where it can do that job. So I don't need to support it. Just like a neck collar. It has its role, initially acute stuff, you put it on. But then eventually we need to prepare the body to do that job. And I think that helps.
Right. So I know you are really enjoying this conversation. However, unfortunately, we have to cut it here. But do not worry. We are going to bring you a second part on our conversation on low back pain. So make sure you subscribe to our YouTube channel and turn on your notification button to be notified when we bring the next episode. So see you soon.